Hi, everybody. This is Eliana Aaron from EmaCare with the daily Q&A. We have a lot of questions today. I don't think I'm going to be able to get to all of them, but I will get to as many as I can. And we're going to start off with question number one. What are the new driving restrictions? So the driving restrictions are 2 people in a vehicle unless they are from the same residence or family and they live together. So that's the family unit. So if you're taking a taxi, that would be the driver and 1 passenger. But if you're traveling with your family, then it could be more people in the car. They are pulling cars over to verify this, so you gotta keep that in mind. Question number 2 is Israel using hydroxychloroquine to treat COVID patients? And if so, how much of the supply do we have? So there have been some preliminary studies that have shown that this medication does help some people with coronavirus, with COVID-19. It's not what we call evidence-based medicine, meaning we don't have a definitive answer if this is helping or not helping. It is still being looked at. It is anecdotally helping some people. My brother, who is an ICU doctor in Florida and is treating coronavirus every single day, tells me it's not working for a lot of people, but we have other reports that it is working for some people. What is our national stockpile in Israel? I don't know what that is. I'm sure it's classified. But if there is a chance that this is going to help people, that I'm sure most countries in the world are trying to stockpile it as we speak. And I know that Teva donated a lot of medication recently. Teva is an Israeli pharmaceutical company, and they donated a lot of this medication recently. How long into semi-lockdown will we know if the measures of the semi-lockdown are working, and when should the case numbers start to accelerate? So I am not a prophet, and nobody is, and no one really knows how this can go. There are epidemiological curves that go up and then down a little bit and then up again. And when they start to go down and people relax and don't take things seriously, that's when they start going up again. So we have to really see if they work. We know that most people get symptoms between 5 and 7 days after coming into contact with coronavirus. So being that we were on official partial shutdown for less than 5 days, I would say that probably we need to see by the end of the week if we're seeing a slowdown in the number of diagnoses. But there's one problem with that, which is as this is happening, Israel's also ramping up the testing. And when you ramp up the testing, you get a lot of people who are going to test positive at a higher rate than they were before. So basically, you may see the numbers continue to go up, and it may not reflect the fact that we are still lowering our contagion. So it may take, let's say, 2 weeks until we actually see how much this is working, and we're optimistic. Okay. Can my wife have her wig done before Pesach? Dropping off and picking it up and wearing gloves and all that. So first of all, whoever is doing wigs right now before Pesach is violating the law, okay? Because that is not an essential operation. And we can't, and that's not something that should be working right now. We do not know how long the coronavirus lives in your hair. We do not know how long it lives in a wig. We do not know, and they use chemicals and shampoos and stuff, but none of that kills coronavirus necessarily. So it's not a good idea. Look, we're all going to be home for Pesach. Let's be real. Who cares? This is not important. This is not important. This is not important. It's just not. We got to get our priorities straight. The most important thing now is safety, and it's not worth anyone's safety to go out and have beauty treatments done, even if it's illegal. People obviously don't all follow the law. I don't recommend it. And guess what? Wearing gloves doesn't really help you because 90% of the people who wear gloves who are not health professionals, and by the way, a good percentage of the ones who are health professionals don't know how to wear gloves correctly. If I have gloves on right now and I'm touching my phone and I'm touching my face and I'm blowing my nose and I'm going to the bathroom and I'm washing my hands, which is nice, right? But then I'm touching my face again and I'm on the phone again and I'm on my laptop and I'm opening door handles. The gloves don't do anything. Come on, gloves don't mean anything. So don't be fooled by someone wearing gloves. It means nothing. Okay. Now we have a compound question. That's fun. Can all of this process of spraying and cleaning the products that come into the house be skipped if you just put all the packages aside for 2 days before using? Like fresh produce could be put in the bag of the fridge, bakery rolls, raw meat, milk bags can be frozen and used 48 hours later, and then you don't have to wash or disinfect. Is that true? And the answer is that's not a smart thing to do, because when I have bags that have been in the shopping mall, in the shopping cart, okay, that people have handled, if it's delivered, then people have handled it, then basically you don't know what's on there. And the virus doesn't live for 48 hours. It lives for up to 5 days on surfaces that are not porous, okay? And other surfaces. So when you're talking about, see, I just touched my face. Good role modeling right there. I'm very careful. When you are talking about surfaces like wood, like the glass in a refrigerator, when you're talking about plastic is like 5 days it takes for the virus to die. If you're talking about surfaces like that, it takes days. It's not 2 days. And remember that you have frozen items that you can't leave out for 2 days. If you put them in the fridge, then they are touching everything else in your fridge or freezer. And that means now you have taken whatever germs are on there. We do not know if they freeze off, by the way. And now they're all over the place, and now you have no idea what's on anything. So, you know, look, you can't do it for everything because there are, you know, again, like I said, fresh produce, certain things, you can't like spray it with bleach. You're gonna end up, you know, poisoning yourself. You have to use your judgment, but anything that you can do this with is great. Plastic bags, you know, I use a clean plastic bag and I wrap up my paper goods or my cardboard boxes and I put them on the floor for 24 hours and then I could just use them and we're all happy. But I don't advise skipping it because it's not a 48-hour deal. It's actually 3 to 5 days. And that's just a little too long, and any fresh rolls that you have are going to taste pretty bad after 5 days. Okay, so someone asked about viruses on plastic, and I think I just answered that. Okay, I think we have more questions for tomorrow. I keep getting a little backlog, but I don't want the videos to be too long. I wish everybody health. Please take care of yourselves, take care of your elderly relatives, and be safe, and I'll see you tomorrow.